The fight against the Zika virus continues in North Florida, along with the rest of the state, while 2 cases remain under investigation, with the fear that they could have been transmitted by a mosquito.
This comes as the health department confirms a 3rd case of the virus in St. Johns County, bringing the total to 17 in Northeast Florida. Channel 4's Nicole Snyder joining us live. Nicole?
Even though these cases are under investigation down south in Broward and Miami-Dade counties, the city of Jacksonville is taking this very seriously. The mayor rolled out his budget earlier this week, and he's dedicated $1 million to keeping the virus at bay. The 2 Florida cases under investigation for local transmission of Zika are in Broward and Miami-Dade counties. But city leaders in Jacksonville are taking the issue very seriously.
We need to make sure that with Zika, with West Nile, with any number of insect-borne viruses, we're in Florida, we're in Jacksonville, it's a public safety issue.
This week, Mayor Lenny Curry announced $1 million in his budget proposal to add a new helicopter to the fleet to combat the virus.
We have mosquito control helicopters, 2 of them, that are old. In fact, so old that it's difficult to get replacement parts. They're uninsurable. We can't even get insurance on them. So the budget that I rolled out this week, consistent with my focus on public safety, includes a mosquito control helicopter.
Putting an end to Zika doesn't stop with spraying. Local organizations are putting new methods into practice to make sure numbers don't go up. With a go-ahead from the FDA, OneBlood is now testing portions of their blood collections for the virus.
Once we had that approval, we began putting the test in place in the blood center, which involved writing processes and procedures, training our staff, making the necessary computer changes.
Dr. Rita Reich says she is watchfully waiting to see if there is confirmation that the 2 cases in South Florida are not related to travel.
If we get alerted that there's an active case anywhere in the state of Florida or any of our service areas, we would immediately report it to, all the appropriate agencies, and we would then launch our Zika plan.
Dr. Reich says that Zika plan has been in the works for a year now. If there is an active case of local transmission, the organization would either stop collecting in the affected area or simply do Zika screening testing in that affected area. Reich says one option would be picked based on the situation at hand. Now, the immediate plan is to begin testing some portions of those supplies to get those 2 high-risk patients at hospitals, such as pregnant women, and then based on the usage at those hospitals, they will expand that testing, and that's expected to begin on August 1st. Reporting live, Nicole Snyder, Channel 4, the local station.